Evaluating the value of VistA by IT person. It is important to evaluate the value of IT investments because the process of implementing an EHR system like VistA is timely and financially costly. Therefore, an organization should evaluate the return on such an IT project to ensure that the benefits outweigh the costs. The Veterans Health Administration, VHA, is the medical system of the U.S. Department of Veterans Affairs. It is the largest single medical system in the U.S., with 180,000 medical personnel and serving 5.3 million veterans. VistA, which stands for Veterans Health Information Systems and Technology Architecture, is an information system that supports information needs of the VHA. Most importantly, it gives VHA providers access to the Computerized Patient Record System, CPRS, as well as to computerized order entry, barcode medication administration, electronic prescribing, and clinical guidelines. CPRS allows VHA healthcare providers to view and update a patient's electronic medical record. The variables used in this analysis were cost of care, IT investment, and IT use for the years 2006, 2007, and 2008. Cost of care and IT use were derived from the Department of Veterans Affairs fiscal year 2008 budget estimate in Table 10. IT use was defined as total number of unique patients. IT investment was derived from the Department of Veteran Affairs fiscal year 2008 Volume 2 Budget for Departmental Administration in Table 9. Using the data from the previous slide, a correlation analysis was performed in Microsoft Excel to determine the correlations among the three variables and to see if there was a relationship between cost of care, IT investment, and IT use. The correlation between cost of care and IT investment was 0.665. The correlation between cost of care and IT use was 0.843. The correlation between IT investment and IT use was 0.962. The correlation analysis showed that cost of care leading to IT investment leading to IT use was closer to zero. Therefore, it was more likely that higher costs of care led to more IT investment and use, and less likely that the reverse was true. In other words, IT investment and IT use are more likely driven by cost of care. The findings suggest that an increase in cost of care is associated with increases in IT investment and IT use. This does not mean that higher cost of care is the cause of higher IT investment and use, but simply that the three variables are related. One of the limitations of the study is time interval, which may not be long enough to fully reflect the effects of an IT investment such as VistA. Another factor that may improve the study is the use of more variables, such as revenue and savings generated by the use of VistA.